Good morning, everyone. We are going to give a couple of more minutes to let folks enter, and probably we'll start about 10:02 or so, just to make sure, because I know that a lot of people signed up for this session, and I want to make sure that the majority are on before we really get going. So thanks for your patience for another couple of minutes. Okay, it looks like most folks are on, so I'm going to get us going so that I am cognizant of your time. Good morning, everybody. We are very excited to be kicking off the second evaluation of HUD's older adult home modification program, the evaluation portion of it with you. Hopefully some, if not all of you, were able to attend our overview of the evaluation in November. But given that 4 months have passed since then, and that we know some people were not able to, we're going to go through the overview as quickly as possible. Again, give you all a chance to ask some questions before we get into the actual REDCap training. So a couple of logistics for you. If you have any questions during the presentation, please type them into the Q&A at the top of the screen or the chat. Um, we have staff members on who are going to help monitor, but that makes sure that we capture all of the questions. And if we run out of time, we will make sure that we're going to send those out. We're also collecting them from all of our training. So this is our third training, and we're going to be putting together all the questions from all the trainings into a frequently asked question document that will go out to everybody, and that we will try to update throughout the duration of the evaluation as needed, so that everybody can go and see other questions that people have asked and hopefully have some common answers. We also know we're going to be covering a lot of information today. You're going to have additional questions about the evaluation, how to use REDCap, all of that after the webinar. Please feel free to contact me or anyone else in the team at any time. We definitely would prefer that you ask questions than try to guess. We're going to put up a slide with our contact information at the end of the presentation. It will also be in the documents that we send afterwards. We also know this is a really long training. We built in a 10-minute break about halfway through, about the 45-minute mark. And we're going to ask that you really stick to the break time and come back to your computers ready to, get back into the demonstration. Finally, we're recording the session. So as organizations inevitably have staff turnover, this will be available to any new staff to watch and learn how to work with the evaluation. So, as I said, we've had 3 trainings. We're going to be sending out the training materials and guides as well as notices for additional meetings. So make sure, please, that you add solutions, my email, to your trusted email so that our emails don't go to your spam folder. We also had initially intended for you to be able to download the training slides along with other handouts during the training session, but we decided not. It could be distracting. So we'd prefer that you focus on the training and the discussions instead. And we will be sending out copies of all of these handouts to everyone after the training. Again, questions later, definitely feel free to reach out. It also was pointed out to us that we use a lot of acronyms, and we apologize. It is one of those things that it is just going to be part of this program just like it is any others. I will try to identify or define each acronym when I use it, but to help, I've put a list of kind of the common acronyms that are used in the program or around the program in the chat. So if you hear an acronym and you have no idea what it is, please go look at the chat, check it out. Again, I will send those out as well afterwards. So when you get information that you don't understand what it is, you'll be able to reference it. So before we get to the core training, I want to introduce you to the evaluation team and to me, especially for those who are just joining us for the first time today. So HUD's Office of Policy Development and Research, or PD&R, is funding and overseeing the evaluation of HUD's older adult home modification program. I work for Healthy Housing Solutions, more commonly known as Solutions, and we are the organization that PD&R selected to conduct the evaluation. And I'm Noreen Beatley. I'm the team's project manager. Our team is composed of experts in healthcare, housing, economics, and it includes our parent nonprofit, the National Center for Healthy Housing, or NCHH. So Jonathan Wilson, NCHH's deputy director, is going to be the evaluation's interim senior research analyst and our ongoing housing policy advisor. I don't believe he's on today, but he will definitely be involved in future events. I say interim because we lost our senior research analyst. She retired a little sooner than we expected. So we will be looking for someone new to take that position. We will introduce that person to you all as soon as possible. Sherry Dixon, who also works for NCHH, is the evaluations biostatistician. So Sherry programmed the data collection forms into REDCap, and she will be leading the statistical analysis of the evaluation data you collect. She unfortunately couldn't join us today to answer questions, but she will be available in the future to answer questions as needed. You'll be sending them to me and I'll work with her. Amanda Reddy, who is the project director and the senior research principal researcher, is not on today either. She wasn't able to join us. I'm not quite sure if if Jagruti Reiki is with us today, but if she is, she may just in the chat say hi. Jagruti is our core or our contracting officer representative, and she is joining us. She's the one who oversees our evaluation for PD&R. So I think we also may have, so we have Ashley Williams. She is the team's research analyst from Solutions with us today. She's going to take notes and help me identify questions so we can get those answered. And I believe we have a couple of our site coordinators on as well, potentially Peggy. If we do, the site coordinators, please just kind of type into chat and say hello. So each grantee is going to be assigned a site coordinator, or has been. They're going to serve as your day-to-day contact for evaluation-related questions and issues. The site coordinators are going to help you with your data collection, ensure that you're completing your evaluation forms in a timely manner, and they're going to be there to answer any of your questions that you have about the evaluation. If they can't answer a question, they're going to bring it to me or another member of the evaluation team. So, although we are conducting the evaluation, the Office of Lead Hazard Control and Healthy Homes is overseeing you, and all of you as grantees of the Older Adult Home Modification Program, you're going to be implementing the program and collecting the client data. So you are also essential components of the evaluation team. So Lead Hazard Control oversees and manages the all of the OAHMP grantees, and the grantees are going to be providing key details of how the program is working, its accomplishments, as well as any kind of setbacks or barriers that you are having to deal with or overcome. The data you collect, whether it's in the field or your office, is going to guide how the program works and is potentially funded in the future. All of the forms you're going to be using for the evaluation, which we're going to be training on you today, have been reviewed and approved by Lead Hazard Control. And as noted in the grants NOFO, or Notice of Opportunity, Funding Opportunity, grantees are required to participate in the evaluation. Just so folks know, this is a congressionally mandated evaluation. Congress wants to see how this program works, and based on whatever we can share with them, that will make their determination about whether they continue to fund it or not. Again, if you have any questions about the evaluation, please don't hesitate to reach out to me or your site coordinator, or in fact, anybody else on the evaluation team. So just to kind of cap or let you know, what are the evaluation goals? So over the next 3 years, we're going to be assessing the program's impact on your clients and the implementation processes. So I want to be very clear on this definition. Clients are the older adults who will be enrolled in your home modification program. They're the folks who sign the paperwork, receive the home mods, and most importantly for our purposes, who consent to participate in the evaluation. The evaluation itself has 3 main goals: assess the impact of the program, the processes of its implementation, and determine client satisfaction with both the program processes and home modifications. So the client data you collect is going to allow us to assess the impact the program has on the older adult clients who receive the home modifications. And we're going to compare your client's health and ability to get around their home before and after the home modifications and to other data sources. So it's going to help us learn how the upgrades helped your clients become more independent or stay independent and be a little safer. And it's going to look at issues such as, did the modifications result in fewer falls? Did it improve the senior's sense of independence and reduce any problems they might have with their activities of daily living or instrumental activities of daily living? So activities of daily living, or ADLs, are the fundamental skills that we need to be independent and take care of ourselves, while instrumental activities of daily living, or IADLs, are the activities that allow people to live independently in the community. For example, ADLs address your ability to walk around your house, safely take a shower or use the toilet. IADLs look at your ability to get out of your house. For example, go shopping, meet a friend for lunch. So while IADLs aren't really needed for functional living, being able to perform IADLs can significantly improve a client's quality of life. So impact components of a person's quality of, impact components of the evaluation are also going to help us determine if the modifications provided through the program helped reduce hospitalizations and ER emergency room visits to potentially produce any kind of healthcare system cost savings. So the process side of the evaluation is going to look at variations and how you all implement the program in your respective community. So we'll be gathering major lessons you learn as you work with the program, summarizing your biggest challenges, barriers, and successes, and asking how you overcame them. We're also going to be interviewing clients, asking about their satisfaction with the program, processes, and the home modifications that they received. So I don't know if I said this or not. Thank you for putting questions in the Q&A. If there's anything really burning, Ashley will interrupt me and we'll try to respond to it right away. Otherwise, we're going to have breaks for questions and we'll come back to them then. But if it's something that I say that really doesn't make sense, please, kind of let Ashley know this is tied directly and we'd like to get a response. So before I go much further, I want to mention data confidentiality. So some of your clients might be concerned about how the data we're collecting is going to be used. We want to encourage you to allay any fears they may have. This is not a research project. It's not a clinical trial, and there are really going to be minimal risks to the clients who participate in the evaluation. So REDCap, I'm going to tell you a little bit more about that shortly. That's the program we're going to be using to collect the evaluation data. It's a HIPAA protected data platform where we will also be storing all the evaluation information for each client. So I'm sure most folks know that HIPAA is the health insurance. I never say it all the way right, but it is in it is in the commonly used acronym. So if folks want to know what HIPAA is, I just use it so often I don't even remember what the words are. But anyway, to protect clients' identities, we're going to have you create and use a study ID for each client to protect all of their personal information. You're going to need to email us, like if you need to email us a question about a specific client, we're going to ask you to use that study ID, not the client's name or the address. We're also going to set permissions in REDCap to limit who has access to certain data. For example, in the most part, each grantee will only be able to view and edit the data you specifically collect for your clients. And you won't be able to see any other grantees' data. Even in there, no, it does not have to be encrypted. I'll answer that right away. There's no need for that because you're using a study ID. We'll come back and ask that again. So you won't be able to see other grantees' data. The other part of that is that because you have certain permissions, some people won't be able to see all the forms, and I'll go into that shortly. If you have sub-grantees, there are 3 prime grantees that do have sub-recipients. You will be able to see all of your sub-recipients' data, and unfortunately, all your sub-grantees will be able to see each other's data. So we're going to have you really pay attention to your field team IDs so that you are not accidentally putting data in somebody else's records. The other thing that we want you to know is HUD will not have any access to REDCap, so grantees and clients can be very open in their data entry, particularly on comments about the program and processes. Similarly, grantees are not going to be able to see client feedback because that will be done with solutions themselves. Another thing to point out is that we're not collecting data from any source other than you all, the grantees and the clients. For example, we're not collecting clients any of their Medicare or Medicaid health data, which is very important. So that's a different level of that we're not going to get into. Additionally, before we have you ask any very health specific questions, we're going to have you ask for consent from the clients to participate in the evaluation. We have an informed consent that you're going to receive and you're going to give to clients. It summarizes all the confidentiality protections that we're talking about. And we're going to ask that you provide the client a copy so they can refer back to it if they want or if they have questions about the evaluation. I'll tell you more about that in a moment. But I also want you to know that when we present the evaluation's findings, no specific grantee, no specific client is going to be identified. Only aggregate data summaries and comment summaries will be used in briefings and reports. So, as I mentioned, for purposes of the evaluation, maintain confidentiality. Grantees, are what the evaluation calls field teams, are going to use study IDs instead of names to enter data for your client. Grantees will all be assigned to a site coordinator, or will all be assigned a site and field team ID. So these don't make sense to you at the moment, but they will. I'll send out a form. but you'll be able to use those, and then you're going to add a number for each of your clients. This basically creates the evaluation's 3-component study ID. So this slide shows each grantee and subgrantee's site coordinator assignment by site ID. And your site ID is your state abbreviation with a number if there's more than one grantee in a particular state. Your field team ID, which is based on an acronym of your name. And then you're going to assign the client number. Right now, you just have the site ID and the field team ID. So, for example, subrecipients from Habitat for Humanity International or Habitat for Humanity East Bay, Silicon Valley, and Virginia Department of Aging Rehabilitation Services, they're going to have the same site ID as their prime grantee, but each of you will have your own distinct field team ID. So for Habitat for International, there are grantees in several different states. So even though you might be in Michigan, you're going to see that your study ID, your site ID is actually going to be GA, I believe it's 2. Yes, GA2, because it is going to reference your particular prime candidate or prime grantee. So as I said, we're going to send these out. You don't have to worry about remembering them. One other thing about this, though, and I'm going to repeat it just so you know, your client ID is going to be a number. We'll talk about it. It cannot be a personal identifier. You cannot use a name, an address, or anything else that could be personally tied to your client name. I'll go over it a little bit more shortly, but I just want to say that, and I'll say it numerous times so that we can make sure that you get that. So again, so the site coordinators are your day-to-day evaluation contact. They're going to help you work with your REDCap data collection and the platform. They're going to ensure that you're completing your evaluation forms in a timely manner, and they're going to try to answer your evaluation questions. So when you send them a question, though, and you'll get their email again with the site assignments, please make sure you always copy me with any question or concern you send to them so that we can make sure that we're providing a very quick, accurate response. And just so you're aware, to a limited extent, we tried to assign grantees regionally, but because some grantees have multiple field teams in different regions, as I mentioned, Habitat for International, and we wanted to balance out the number of grantees and client data the site coordinators will be working with, that didn't work. So we may, as we get into the evaluation, find that we have to tinker with the assignments. If we do, we're going to let you know. One other thing, and again, I'll mention that probably more than once during this this training, your site coordinators will be doing a monthly QC check or quality control check. And you will get, once we start the data collection, you will get this quality control check, and it will identify any issues they may find with the data collection. So they're going to do one on a monthly basis. But as we get going, if there are certain things that they see that, oh, this is a kind of a standard incorrect thing, rather than waiting a month, we might let you know. So if you're putting in your study ID incorrectly, we're going to let you know, hopefully, a little bit sooner than a month down the line so that you can make that correction sooner rather than later. Okay, so as the HUD NOFO, Notice of Opportunity Funding, indicated, all grantees, both prime and subrecipients, must participate in the evaluation. So I wanted to kind of reinforce this idea. The older adult home or lead hazard control oversees your program work. PD&R oversees our or solutions evaluation work. We want to really make sure that everyone understands the difference. Any questions you have about the grant program itself should be directed to Dr. Blue or your specific HUD Government Technical Representative or GTR. Any questions you have about the evaluation should come to your site coordinator. We also call them SCs, or me, or any member of the solutions team. So the solutions team can offer advice and answer questions you might have about any step of the evaluation, but we can't give you any technical assistance or answer any questions specifically about the home modification grant program and how it works. And the same is true. Your GTR, your folks in the older adult home modification program, they really can't be answering questions about the evaluation, so you should send them to us. They'll try when they can, and just like we will try, but we will always refer you to the other side because we want to make sure that it's very distinct. Okay, so I'm going to walk you through the evaluation steps pretty quickly. And we put together this flow chart to kind of help you understand how the evaluation should be able to blend into your implementation of the older adult home modification program. We shared this during the overview for those who attended that session in November, and we're going to send out the flow chart in our package that, after the training. The first 3 steps that are shown on the form, kind of on the left of the slide, these document the client's eligibility, when you're going to conduct your home visit, or what the evaluation calls the baseline visit, and then installing the documentation and documenting the home modifications. And they're designed to kind of fit very smoothly into your program operations. So you're going to be entering and storing HUD required program data in REDCap, answering the forms that we need for the evaluation for the program. The last 4 steps, in which you're going to conduct a follow-up visit with your client 6 to 9 months after you've completed their home modification. You're going to complete an online, grantees are going to complete an online survey annually, informing your clients to be on the alert for a potential call from us, because we're going to survey a subset of them. And for some grantees participating in a site visit with solutions, those are evaluation only steps. So when you look at this, anything in green is definitely something for the program that we have enmeshed with the program. Anything in blue is going to be specifically for the evaluation. So you can't see it very clearly here, but we've also identified the forms you're going to be completing at every step. I'm going to go through this in a moment a little bit more clearly, and we are going to give you the demonstration shortly on those forms as well. So step 1, client eligibility. Again, is there latitude for visits outside of the 3 points? I'll come back to that question so that I can understand. We'll think about this. Okay, so in each flowchart step, green, again, program, blue, evaluation. And as you'll see, a lot of these are the same or they overlap. For example, the evaluation has no separate eligibility requirement. If you determine that a person is eligible for the older adult home modification program, they are automatically also eligible for the evaluation. So at step 1, the only evaluation task we have for you is to complete the client eligibility documentation form. Now you're going to complete this for both people that you find are eligible and those applicants who turn out not to be eligible for the program. This is the only form that the client or that that the evaluation is going to collect with any kind of personal information for the client, their names or addresses. You are not using this form to determine eligibility. You're only using it to document whether or not an applicant is eligible or not for the program once you've made the determination. And the reason that we ask you to do this for both folks who are eligible and not eligible is so that we can get a sense and we can let HUD know, okay, wow, a lot of the grantees had folks that were not eligible for the program because most of their applicants were 60 or 61. And that 62-year-old breakpoint is very hard. HUD has already made some changes in how the program works for the next cohort based on some of the feedback that they've gotten from this. If they are not eligible for the program, we're going to have you complete what's called a loss to project form. And this is going to tell us in HUD how many folks were found ineligible and the reasons why. When you look at the flow chart, for almost every step, you're going to see an arrow pointing to the right that documents any clients or potential clients lost to the project at any stage of the evaluation or the program. And we're going to have you complete these to help HUD learn when and why clients are lost. So when you fill out that form, I'll show it to you in a moment, it asks questions about why the client is no longer in the program. Okay, step 2 is your initial home visit. This, and again, this is our baseline visit. During the visit, this is when your staff is going to conduct, their routine practices, program practices. So the Older Adult Home Modification Program requires that grantees use standardized assessment forms, and we design the evaluation forms to comply with this requirement. So the blue block shows that your staff is completing what the evaluation calls a baseline visit, because you're going to use the forms to collect the client's baseline health and physical function information before you do any home modifications. So during this visit, your occupational therapist assistant, or certified aging in place specialist, that's OT, OTA, or CAPS, are going to complete the client program questionnaire with the client. I'm going to say this now, only the OT, OTA, or CAPS may complete these forms with the client. I'm also going to mention that even though it is always going to be the OT, OTA, or CAPS, I may use shorthand going forward and just say OT, so I'm not saying it over and over. Anyway, the program questionnaire is the form that's going to ask them about their ADLs, their IADLs, their falls. A lot of you may already be collecting some of this data, a lot of this data as part of your program. We just need to make sure that you're entering it into REDCap, again, so we can collect it for the evaluation. So during this visit, staff's also going to complete the home hazard checklist. In this case, it can be the OT or home assessor repair person on staff. They're going to do the home assessment, and they're going to document any housing related issues they find on the checklist. Again, this is a standardized tool you can use to help identify and record any home health hazards before you do any work. The next two forms, the consent form and the client impact evaluation, they're marked in blue because they're strictly for the evaluation. So before the OT conducts the client impact evaluation interview with the client, and again, this must be done by the OT, OTA, or CAPS, they're going to need to ask the client if they consent to participate in the evaluation, and they're going to complete a standardized consent form with the client. So we're going to give you an informed consent package. It's going to be sent to you. It's also going to be available to download from the file repository on REDCap. I'm going to show you where that is in a minute. What we're going to ask grantees to do is print out a copy of the consent form prior to the home visit. We're going to ask you to leave that behind with the client. That package, it provides our contact information if they have additional questions about the evaluation. Initially, we were telling grantees to print out 2 copies, one for the client, one for the grantee, because we need you to send a verification of the signed consent form for us. But as long as you take a picture of the signed consent form page and can upload that for us later, you can do it with the tablet or your phone, whatever. You don't actually need to do 2 copies. The package is also going to include a cover page that you'll complete that provides the client contact information for your organization and HUD in case there are any program-related questions. What we found with Cohort 1 is that because we ask grantees to leave this package with the clients, very often the clients reached out to us to ask about their program, about the home mods, that type of thing. And of course, we can't answer that, and we wanted to step out of that. So we have put this cover form on the consent package so that you fill that out for your, for your clients, along with the consent form when you leave it behind. This is an important part of this. If the client doesn't want to participate in the evaluation or sign the consent, we're going to ask you to gently encourage them to participate, but don't push it. If a client's firm and not wanting to participate, they're probably not going to participate, and that, they're not going to give us the information we need. So, that's a really important thing. But again, here's where they say we don't want to participate. Again, you're going to complete a loss to project form for that client. This means they're lost to the evaluation, but they are still eligible to receive home mods or program services you provide. It does not stop them from getting the services that you can provide through the older adult home modification program. But I'm going to say that it's really important that we get as many clients to participate as possible, to allow us to assess changes in the client's health and function due to your program and your work. So that's why we're going to ask you to gently encourage them to participate and to share with them how the program, what impacts the program's going to have on them, to make sure that if they're beneficial, that other people can benefit from them as well. And then one last thing about this visit, regardless of whether, one thing I think I skipped over is that if the client says that they don't want to participate in the evaluation when you're doing the client impact evaluation, the OT is not going to ask all those questions. It's going to end that interview. And you will see that on the form shortly when we do the REDCap, but I want to point that out. But regardless of whether the client agrees to participate in the evaluation, you must complete the program questionnaire, the home hazard checklist, and the first part of the client impact evaluation for every client that you enroll in the program. So even though we may not be able to use their information for impact, we will be looking at how many people applied, what kind of housing conditions were they in their homes. And that's the type of stuff that we will share again with HUD for the program. It will give HUD some ideas about things that they may be looking into or need to look into for other programs. Okay, so the older adult home modification program is what's called a person-centered program. That's why it requires an OT. Your OT is going to work with the client to determine what home mods should be done and prioritize them. And then your staff, your contractors, they're going to work with them to complete the mods. As shown in the blue box, for the evaluation, we're going to need you to document what modification work was done or installed in the home, or what adaptive equipment was provided the client, along with any labor and materials costs. So grantees are going to complete a form in REDCap. But then part of that is also completing an Excel spreadsheet as you're doing the home modifications, or as soon as possible after the work is done. So I'm going to walk you through the form a little later, but we're going to want you to document the work you did with the older adult home modification funds, as well as any work you did with funding from other programs, for example, weatherization, CDBG, or with donated materials and labor. So again, this is going to help us understand, what are the issues? Is there stuff that has to be done before you can use the home modification program funding, or that you have to go back and do? Are there ways that we can help HUD understand how to make these programs potentially more integrated or leveraged better? And again, if for any reason clients lost between the initial visit and the home modification, we want you to document it on the lost to project form. Okay, so where are we now? Okay, follow-up. So you're going to be doing 2 follow-up visits for your older adult home modification one. One is the post-home modification follow-up visit required by the program, required by HUD, which you're generally going to do within about a month or so after you've completed the home modifications. For the evaluation, shown in the blue box, I always do that. We need grantees to conduct another in-home visit with the client. This is going to happen about 6 to 9 months after you finish the home modifications. During this visit, your staff is going to repeat the client program questionnaire, the home hazard checklist, and the client evaluation interview with the same client your staff spoke with or identified as the client at the initial baseline visit. So this visit's going to provide us with a post and the pre and the post modification data that we need to compare how the program worked. the pre and post modification, how did the mods impact the client? It's going to be the main way that HUD can fulfill the congressional mandate that the older adult home modification program improved older adults' health, physical function, reduce falls and improve their quality of life. So this amount of time, that 6 to 9 month window, it's going to give the client, after the mods, it's going to give the client time to get used to the what you all did in the home, and it's going to help them balance out any positive or negative feelings that they may have initially had about the home modifications or the program. So ideally, the person doing the follow-up visit and completing the forms is the same OT that met with the client at the initial home visit. So for example, they're going to hear the responses in the same way. They're going to visual check for the home hazards the same way they did it at baseline. But we know that's going to be difficult for some of you and that the same person may not be available. The baseline visit, most of those forms have to be done by the OT. Some of you don't have OTs on staff. So we've made an adjustment and said, okay, you can have someone else on staff do these in-home visits. Preferably it's someone else on staff who has had contact with the client or has built a rapport with the client to do the home valuation. Another thing to think about, depending on your program, you may not generally, contain or maintain your contact with the client after you finish with the home mods. So we're going to suggest that you stay in touch with your clients between the home modifications and when you're going to have to do that 6 to 9 month post home modification follow-up assessment. Periodically confirm that the client still lives there, remind them of the upcoming evaluation assessment. Just kind of build that rapport and stay with them. It might help you maintain, your supportive relationship. You can also use these opportunities to remind them that someone from Solutions, my organization, might contact them to complete a client process survey to learn what they think about the program and its processes. So we also know sometimes getting in touch with the client's not going to be possible. If you run into issues reaching the client, we want you to give at least 5 times to set up and conduct that follow-up assessment. If for some reason you can't get in touch with them, they moved, they're just not responding to you, again, we need you to complete a loss to project form. But we really, really want this as a last resort because it means the client's data that you spent time collecting, that you posted to REDCap, that's now lost to the evaluation and our analysis of the program. So really and truly doing, trying to do the follow-up assessments and saying, going to loss to project, that's going to really not be great. Okay, I'm going to speed up a little bit. Sorry. So, okay, step 5. These next steps are solely for the evaluation. They're going to be used to collect information about the processes that both HUD employs to administer the program and that grantees, you all, employ to implement the program in your community. So on an annual basis, basically 3 surveys over the course of the program, we're going to have 1 representative for each grantee, and that's both primes and subgrantees are going to complete an online survey. We're going to only accept 1 survey from each grantee, but we encourage you to make it a group effort. Have everyone working on your program look at the survey, provide their responses based on their experiences. That way we're going to have, a better sense. You're going to compile it to put it in the survey. The survey is going to have a window of time to be completed. And once the survey time, the window closes, you're going to be able to see your responses, but you're not going to be able to change them. So we designed the survey to collect your impressions of your experiences with the older adult home modification program and share your successes, the barriers, the lessons learned, and the things that you experienced at various points in the grant's period of performance. For example, at recruitment, at enrollment, at home modifications, when you were doing those. So the survey is going to help the evaluation team Solutions understand your program management approach. How or if you were able to integrate your existing older adult program with HUD's grant program. if how you were able to integrate or leverage other program resources like weatherization, CDBG, with the older adult home modification program, as well as your satisfaction with HUD programs processes. So this is an opportunity for you to provide feedback. Again, the responses you give are going to be anonymous. HUD's not going to have any access to the raw survey data during or after the data collection. Solutions is going to compile all the feedback we get and submit the findings to HUD without identifying any specific grantee. This survey is really and truly a confidential way for you to be open with feedback about the ups and downs of the HUD program. The second component of the process evaluation is a client interview or survey. So grantees, just like HUD's not involved in your process evaluation, grantees are not going to be involved in this for the clients. You're not going to know who we're contacting, but we are going to ask that you make sure your clients know they might be contacted by Solutions. Just so you know, it's going to be a 443 area code. And our site coordinators are going to contact a subset of clients to get their feedback on their experiences with the home modification program. They're going to be interviewing a subset of clients within about 3 months after the modifications were done. Again, when we report the survey results to HUD and you all, the feedback is going to be summarized and no one single client is going to be identified. Similar to how we're saying, your information is going to be anonymous, this is going to allow grantees to feel comfortable providing us honest and complete feedback, and helping let us know whether the mods are really helping them stay in their home safely. So these are really important. I want to stress how, they are very key to us. So similar to your 5 attempts, our site coordinators are also going to make 5 attempts to make contact with the clients. And if they don't reach them, they're going to complete a loss to evaluation form. You're not going to have access to that because if you have someone we don't want to lose any client data if we can't do an evaluation. So our site coordinators are going to do the loss to evaluation form. You are not, just so that's clear. Okay, the final part of the process is I will be conducting with your site coordinator site visits over the course of the 3-year period. I'm not going to be visiting everybody, just a subset. I'm going to reach out to management, actually probably the whole staff, to coordinate the visit, probably about 6 weeks before we want to do the visit. The visit, again, is going to be an opportunity for us to have informal discussions with you and your staff about how you're implementing the program, get your feedback on the processes in the program, gather any documentation that you use to help us understand specifics of your program, and get a sense of how things are going and how you think the older adult home modification program impacts your community and clients. I want to point out these visits are not audits of your evaluation participation of the program. These are simply another way for us to gather information. We're also going to ask that we accompany you on a couple of home visits to gain a better understanding of your interactions with clients in the field. Again, all confidential. So I'm going to wrap this up pretty quickly, but I wanted to say here's a quick summary of the forms. You're going to do the documentation and eligibility once. You're going to do the client program questionnaire 2 times at baseline and follow-up. Same thing, the home hazard checklist. Once you get the informed consent, you're going to do the client impact interview. That's going to be at baseline and again at follow-up. And then the documentation of home modification work you're going to do once you have finished the mods in the person's home. If at any point people are lost to the project, you're going to complete a lost to project form. I'm going to point this out very quickly. So one thing, when we initially set this up, we had you do this in a specific order. The only form you must do first is the client eligibility documentation. You must also have an informed consent before you can do the client impact evaluation, but you can do those 3 forms that you're going to do 2 times. You can do them kind of in any sequence. I know that most of the grantees that I visited during the site visits, they did the client program questionnaire and the client impact evaluation first, so that, and the consent form then, and then they did their home hazard checklist. We initially said you had to do the client program questionnaire, then the home hazard checklist, then the impact, only because we want the informed consent. I'm going to reiterate, if you do this in a different sequence than listed here, even if the client does not agree to participate in the evaluation, you will still complete the client program questionnaire, the home hazard checklist, and the first part of the client impact evaluation interview. So we're going to give you a copy of this slide, so don't try to read it really quickly. It's going to give you a synopsis of, what forms are completed when and by what staff member, especially if there's a specific staff, such as an OT, that has to complete it. We want you to pay really close attention to the forms completed at baseline and follow-up. So if the data is entered in the wrong data REDCap form, say someone enters data into the follow-up instead of the baseline, you're going to have to delete the form and re-enter the data. And we know that you've already spent a lot of time on that. We don't want you to do that. Okay, next thing. So last thing about the evaluation, we're going to offer several ways to ask questions about the evaluation and get responses from us, as well as opportunities to talk with and learn from each other as you implement your program and collect evaluation data. So we're going to have optional online monthly office hours, a set time every month when grantees can meet with the evaluation team and other grantees via Teams for Q&A, questions and answers. They're going to most likely start in May, potentially not until June. They're probably going to be held the first Thursday or the third Thursday of each month. I will send out an invitation. You're also going to have our work email and phone numbers to contact us. But the monthly hours were something that Cohort 1 said would be helpful. Sometimes how those will work, by the way, is we will open it up. If nobody has questions or no grantees join, we'll leave it open the whole time. I'll be working there. People can join whenever. They're going to stay open. Most of the time, we had people on the whole time. Sometimes we had nobody. They're optional. You can join or not. The next thing we're going to do is an optional peer-to-peer webinar. This is an opportunity for you to share information. So every session is going to be themed for specific job roles or positions. For example, we're going to offer one for OT, OTAs, and CAPs. We're going to offer another one for the grant managers and directors, and another one for for construction managers and so forth. These are an opportunity for the different disciplines to talk to each other, to learn from each other, to share anecdotes and important lessons and milestones, and to get some questions answered by your peers. Like, how are you doing this? We're running into this problem. How did you overcome it? Excuse me. So during these, we're going to sponsor them. We're going to give you some prompting, but these are going to be chances for you to talk. We're going to try to document some of the lessons, challenges, successes that you share with each other. But again, the information shared during the session is anonymous. HUD's only going to get a summarized list of what we hear during the sessions without any specific individuals or clients being identified. Communication. So this image shows that the communication goes in both directions. We need to talk with each other and share information. Open communication is really important to helping the evaluation mesh with and meet your program goals. It's also critical for us to accurately evaluate the program, to capture your experiences, and to understand the challenges and opportunities that you're having as you implement the older adult home modification program in your community. So 3 grantees, as I've mentioned, have multiple sub-grantees implementing the program. Those sub-grantees should also participate in any evaluation event, the monthly office hours, the peer-to-peer webinars. All of the field teams are directly collecting evaluation data, especially these sub-grantees, because they're the folks in the field interacting with clients on the home. It is critical that they be able to communicate with the evaluation team and other grantees who are implementing the program. So, we want to make sure that they know. We know that lead hazard control generally just works with the prime. The evaluation will work with all of the grantees. Okay, we're going to take a quick moment to stop and see if there are any questions about the evaluation protocols and forms. I know that a couple came in while I was talking, and I'm sorry that I was talking so much.
Yeah, so we have a few.
Okay.
First question, are we tracking IHSS hours or CG hours, i.e. money spent on caregiving as a measure of success?
No, those are not part of this program. So if you're doing additional caregiving or anything else in your program, those are not, as I understand it, anything that is covered by the adult home modification program. If you want to tell us that you did something else, but we're really focused on the home modifications. I know that an OT generally, when you do your assessment, you go in and do a whole package. This is really directly done for the home modifications that are done in the program. So we're not tracking that kind of information.
Thanks. Another question. Is there latitude for visits outside of the 3 points of contact here? Wondering about training with OTs for fall prevention.
Okay, so first off, so this program is not a fall prevention program, and we are the evaluator. That's the kind of question if you're looking for visits or trainings for your OTs or other staff members, that's a question to go to Tanika or your GTR. We're evaluating this specific program, so we're only doing trainings on this specific program and giving you opportunities, your staff, to talk to each other about how this program is working for them. So I think I'm answering this question correctly. If I'm not, please put back up and we'll try to address it. So when you say, are there, any other latitudes for more training? That's something to ask lead hazard control staff, not us.
So they mean training for clients for fall prevention.
Oh, again, that's not us. That is, and also that is not something that is, that is not covered by this program. So for fall prevention training for clients, that would be another program, to be honest. So that is something to ask your GTR. They may be aware of it, or again, this is where the peer to peer come in. If you are looking for that and you don't have it during one of the peer to peer sessions, which won't be for several months, you might ask your peers, hey, how are you doing this? It's not covered by this program, but we want to be able to do it. So is anybody else doing it? So hopefully I got that one. Yeah.
Yeah. Thanks. So another question, do we have a minimum target of participants to achieve significance? This might help us coordinate timelines, goals.
Okay, so this program does not do any training for clients, except training on the home mods that you've done or installed modifications. Your participation, the minimum, we want all of your clients to participate. We know that some might not. This is an evaluation of the older adult home modification program. It's not an evaluation of your clients. It's not an evaluation of the grantees. So I'm not quite sure when you say a target minimum of participants to achieve significance, we need all of your clients. So we're not setting any minimum. We want all of the clients who are participating in the program to, as feasible, to participate in the evaluation. Again, hopefully that has answered it, because this is not a program for training for clients for prevention of falls. This is a program to install home modifications or provide adaptive equipment to help them remain safely in their home. So it's a little bit more than just falls. And so it would capture more than that. I want to actually also address earlier, someone said, when you send an email, does it need to be encrypted? No, it does not. Because we have that study ID, no one else is going to know. So when you send us an email, you can just send it directly to us. So James, hopefully I answered your questions or clarified, but if not, please let us know or come back and we'll try to make sure that we're a little clearer about what this evaluation is about and what we're doing here. Any other questions before I kind of give you a quick overview of REDCap? We're going to do a quick overview of REDCap, and then we're going to take a break and then do the demonstration. But this first overview is going to give you a sense of, what REDCap is for those of you who've never heard of it, which I imagine is most of you. Okay, so what are the eligibility requirements for the clients? So these are program requirements, but the program says that clients must be at least 62 years old. They must have a household income of no greater than 80% of the local AMI, and they must be homeowners. They must be homeowners and live in the home that you're modifying. So the eligibility requirements are in the NOFO, and they are going to be, that is part of your program. So that is not something that the evaluation sets up at all. We are only documenting it so that we can tell HUD who was not available for the program, and then it gives us the information to then follow up also with the client process evaluation. Okay, next question. Yeah.
Let's see. Ideally, all clients served by the program will agree to participate in the evaluation/follow-up phase, but obviously some may fall out as lost to project. Is there a significant percentage of that occurring? At what point would that be addressed over the 3-year process?
So as I said, we're going to be doing some quality control over the 3 years with everyone. We're going to be looking at the forms you've completed. We're going to be looking at what's not completed. If we are getting a lot of lost to project forms because people aren't participating, we'll let HUD know. That is not something that we will make a decision on ourselves. That's a HUD issue, because I don't think I pointed this out. We're hired by HUD Solutions, but we are not HUD employees. So we don't make any of those determinations. But if we find that a significant percent of folks are not participating, we're going to let HUD know. That's part of the reason why we need to monitor your data very closely. I will say, if a grantee always seems to have someone who none of their folks want to participate in the evaluation, that's going to send up flags for HUD. And so while there are things that are anonymous, HUD does get to see the forms, not the forms, not the responses, but we do let them know, okay, this grantee is not completing the forms because this is a requirement for the program. So they do get the kind of the summarized data, this grantee has not done this, or this grantee is not doing this, or every single client seems to be lost a project. HUD's going to know that. They're going to reach out to you and ask you what's going on. That's not a determination that we would most likely make. But if there's a, who knows? I will talk to HUD about that. Hopefully that's not going to happen. Because as I said, this is congressionally mandated. If people aren't participating in the evaluation, we can't get the data to give to lead hazard control, who needs to give it to HUD or to Congress. If Congress doesn't get the data, I would imagine there will be the funding for this program will be lost or cut. So sadly, but yes. Any last questions before I move forward? Okay, so we're going to do a quick overview of REDCap. So you've heard me say REDCap over and over and over again. So REDCap stands for Research Electronic Data Capture. As I previously mentioned, it is going to be the secure HIPAA-compliant portal that Solutions, the evaluation, is going to use to collect, store, and manage, all of the evaluation data. So all of the forms you're going to be using for the evaluation, they have been programmed into REDCap. They've also been approved by lead hazard control staff. And as I've already said, grantees are required to complete the evaluation forms for your clients. So we selected REDCap because it can be used both online and offline with a laptop, tablet, or smartphone. It is easy to use in the field, much easier than the paper forms, because REDCap does a lot of the work for you. It does, it'll skip questions as needed, what's called skip logic. Every grantee, as I mentioned earlier, is considered a field team, and each field team only has access to their data. So of the 13 Cohort 2 grantees, 3 have multiple field teams. The field teams for those prime grantees, they will have access to the data of the other field team, of the other prime sub-grantees in that cohort. So it's very important that they pay attention to which client records they are accessing when they go back to put in data. So those are going to be the Habitat for International, Habitat East Bay, Silicon Valley, and the Virginia Department of Aging and Rehabilitation Services. You need to be very, very aware of your field team IDs and only access your client records. Okay, next. So with REDCap, as I said, it's available online or offline. Online's always our preferred method, but we know that some of you won't be able to use it in your clients' homes, especially in rural areas. For the online, you have to have internet access. But the good news, it's web-based, so you don't have to download it. There's no software needed. And it can be used on a computer, a laptop, an iPad, an iPhone, tablet, whatever. Offline, you're going to have access. Not everybody, but many of you are going to have sorry about that. I thought my phone was off. So I'm going to try to turn it off. And okay. Apologies for that. Okay, let's see. Yes, whoever just put that, you can log into REDCap, Google, whatever, through any browser system. So the one thing about not everyone will have access to the offline, which is the REDCap mobile app. Only the people who will need it in the field. And in that case, you're going to have to download the app, however you get your apps on your mobile device from Google Play or Tunes. You're going to have to download it on your tablet or your phone. And the data that you're going to use on the mobile app has to be synced with the online REDCap before and after you do your data entry. So you're going to sync beforehand to download the client records. That's going to give you access to the client records when you're in the field. And then when you get back and you have secure internet, then you're going to load all the data that you entered while you were offline in the mobile device back to the server. And that's going to be able to load it back up. And it's going to then store it in the REDCap platform. Okay. Sorry about that. I mentioned earlier, you're only going to have limited access. So some of this is actually, I think I just changed one thing, but I'm putting this up here because I need folks to understand that not everybody has access to the same forms and functions of the team. And this table shows how we're going to be assigning the REDCap permissions and why it's essential that we know what role your team member has. So folks who are working in the field, such as the OTs, CAPs, the home assessors, repair, they're going to receive the broadest permissions. They're going to get like the full grantee enter because they're working with the field. And on the most part, OTs have been trained to get a response. If they get a response on a questionnaire that needs follow-up, especially like mental health expertise, they're going to know how to address that. Whereas your admin stuff or somebody like that is not going to know how to do that. Program managers have the next level because they're going to be assigning staff and keeping the data organized. Project directors and admin folks will have lower permissions based on their need to access and enter data. We also will, program managers and directors are going to be able to download reports, but they're not going to be able to access client records. The admin role, they can complete the client eligibility form. They can also help enter the data from the work documentation field. So at the bottom, we have a shaded role. This is really reserved for very specific grantees whose project director or program manager is also going to serve as your OT or your home assessor for your organization. That is really limited. You need to tell me that, oh, I'm the program manager, I'm also the OT, I'm also going to be in the field, but that is very limited. We also will likely be adding an additional role for grantees who are going to have alternative staff completing their follow-up evaluation visits. You will need to let us know if your OT is not doing those follow-up visits, and then we will assign that role accordingly. So learning how to use REDCap. So we're going to have trained or done all of our trainings by the end of today. So we'd hope to have the information we needed to set everyone up with access to REDCap before the trainings, but unfortunately we didn't get all the information. We did set up a lot of people today. I think if I got your information, then we likely got you set up today. You may have already gotten notice from REDCap that you've been accessed. If not, let me know. We are going to try to make sure that everybody gets it by the end of the week, because then we want to give you about 2 weeks until close of business, April 11th, to get online and work with the programs, to learn how to use the online system. And then once you've learned how to use the online server, to then work with the mobile app for those of you who will have access to that. During this time, however, during this training, do not enter any data for any real client before the official date launch, because we are going to, after we get this information, we're going to give you this time to work in it. We're going to delete everything. And so it will not officially launch until the 15th of April. So if you enter your data for clients, real clients in beforehand, it's going to be wiped out and you're going to have to re-enter it. I'm going to send an email letting folks know that REDCap is live for the evaluation sometime on April 15th. Hopefully it'll be first thing in the morning, but just in case we run into issues, please be patient. Wait till you receive the email to enter any client data. Okay, so a couple of general guidelines on REDCap. You always need to answer your questions sequentially so that the skip logic works properly. So it's going to work so that based on your answer to a question, the next questions are going to appear or disappear. For example, if you answer no to a question, our kitchen appliance is malfunctioning, REDCap's going to skip the next question that asks which appliances are malfunctioning and take you to the next relevant question. We're also going to recommend, and I'll show you this shortly, using the tab key to move from one question to the next so you don't miss any questions. But then you're going to need your cursor to select or answer the question to answer the question in a table. So, or actually any question, you're going to need your cursor to actually click on it. Another thing to know is that if you're not working in the program for a while, and I'm going to show it to you in a moment, the system shuts down after about 30 minutes of non-use. Okay, again, on the most part, you're only going to be able to select one option for multiple choice question. So if you select the wrong option, you can just go to the next one. However, when there are multiple answers are allowed, you're going to see the instruction. It's going to be indicated in blue italics. If you select any that are incorrect, you're going to use the reset button to clear all the selections and start again. We're going to ask you to really pay attention to this, because when we have missing data, it's problematic because we might have to eliminate all the data for a person if their interview or any of these forms are not complete. I want you to know, so we've color coded the forms. You'll see it when I open it. Blue italics are going to be the instruction for you all, for the user. Anything in black bold is the script that you're going to need to read to the clients. And in some cases, many cases, most cases, that script is really important. We need you to read it verbatim because it matches how the questions are presented on data sets that we're going to be comparing the data to, you know, HUS, whatever data set we end up comparing it. So we have to be very aware that it's being asked the same way. So this is kind of what it's going to look like. So the blue, instructions for you, black bold, script for you. The saved data is going to be in the upper right-hand corner. I'm going to show you how that works shortly. You're going to see a lot of these required. Anything in red, must provide a value. And REDCap's going to tell you when you don't provide a value. So just so you know. Okay. A little more information. REDCap terminology. They call them DCIs or data collection. Those are the forms. In REDCap, you're going to see baseline follow-up. Those are the separate collection periods or types. And then you're going to see your data access group, but you're probably not ever going to pay attention to it. That's showing you what data you're permitted to see. And then we want to be very clear when we talk about server, that's the online platform where you are adding, where things have to be uploaded and downloaded if you're working in the field. But that is going to be your main source for where you're going to store and manage the data and where we're going to get access to the data that you have collected. Okay, so we're going to go through this very quickly. So some of you, as I said, may have gotten your REDCap access today. And if you haven't, what you're going to get is an email with this subject line. Okay, somebody has just given us an email with no name or contact information, so we're not going to always know. Okay, good. Yeah, sorry, I have to remind people that we can't work with it. We don't know who you belong to or what grantee we belong to. So great. Sorry, Ashley. Thank you. Okay, so you're going to receive an email. Just so you know, it's not going to come from HUD or Solutions. It's going to come from Vanderbilt because that's who manages the REDCap system. And it's going to say your access has been granted. When you set up your password, save it somewhere. We do not have access to your password. And if you lose it, you can't remember it, we're going to need to have access reset it for you. That can take up to 5 business days. It can put really hinder your ability to do work. The next thing is, please do not share your username and passcodes. I'm going to say it several times, but you do not, every staff member gets their own username, their own passcode. Do not share it with anybody else. It's also not going to work with the 2-step login system that we're going to talk about in a minute. If your staff leaves the project, let us know ASAP so we can delete them from REDCap. That maintains our HIPAA protections. If you have a new staff join, let us know. We'll add them to REDCap. We will do that on an ongoing basis. So for this purposes, getting it going, we've done everything on batch, but going forward, we will be doing it as needed. So most of the slides that I'm going to share, most of the information I'm going to share on the next few slides are also going to be available in a REDCap guide that we're going to send out after the training. It's also going to be posted in the REDCap file repository for folks to download when you need it. Okay, as I said, you're going to get the first time, you've set up your passcode and everything. When you need to go back into REDCap, this is what you're going to click on REDCap Vanderbilt EDU. And it's going to ask you for your username. This is also something interesting because it's one of those things that most people, we have a sense about how our username is going to work. It's not going to work the same way. For REDCap, your username is going to be your first name _ your last name. And the password you select when you set up your account. That's why you must remember it. So some of you might be using REDCap, or you've used REDCap in the past, in which case you're going to have to go down and say which project you're you're looking for. And in this case, it's going to be the Cohort 2 OAHMP. That's Evaluation of the Older Adult Home Modification Program. That's going to be your project. So when you select that, actually, that's before you select that. I had that in the wrong order. When you get your code, you're going to have 4 options to receive the 6-digit code for the second step of your two-step login. Most of the time we use the SMS or the text that will come straight to your phone. When you get that, you can like put anything into that and it automatically provides access. You can also use an authenticator. You can also get a phone call. You can also get an email. You'll only get a phone call if you ask for it and the number has been provided, if you've set it up. One little thing to remember, so that's the SMS code. If you get this on your phone, all you have to do is plug in like anything, hit submit, and it automatically loads you. One thing that we're going to point out is you should always select this box at the top so you don't have to do the 2-step login more than once in a 24-hour period. And as I think I said earlier, after 30 minutes, it tends to log you out. You won't have to go through this whole step if you've set it up for the 24 hours. So we're going to go through this in a moment. It said that how you're going to create your new client records. Generally, you're going to do this in the office. So your admin staff, your program managers can do this. During Cohort 1, some folks were saying that the OTs were having to do this. The OTs generally are not going to be able to do this because you're making the determination for your program. And especially if your OT is not directly part of your staff, they're not going to have this knowledge. So you should do it in the office. The same people who are verifying the client eligibility should go ahead and fill out the client records and the client eligibility form. So again, your study ID is going to consist of your state abbreviation. If there are multiple grantees from the same state, there's going to be a number after the state. Make sure you include that number. Then it's going to be the site ID dash, the abbreviation for your organization. So we're going to assign the abbreviation. You're going to see it on the list that we send you. We're sorry if you use another standard abbreviation, but we're trying to make it simple for the evaluation. So it's going to be the site, your field team ID, which is your abbreviation of your organization dash, and then the client number. Your client number at a minimum should be 3 digits. We recommend that you start with leading 0, so 001. We recommend that you also use sequential numbers so that other staff know what number to use for the next client. So, don't use random numbers. Don't use addresses. Don't use names. No personal identifier should be used with that client number. If you create a client record by mistake, you are not going to be able to delete it. So you're going to let us know that it should be deleted. So your site coordinators are periodically going to be checking the data. If they see a record saying delete after you start collecting data, or they'll delete any record that you mark with delete. Once you start collecting data, they'll send out quality control reports, as I mentioned, on a monthly basis. But they're also going to periodically let you know about simple issues like this so that we can fix them sooner rather than later so that they're not a bigger issue later ongoing. They also are going to look and say delete. If you have delete there, they may reach out and say, we see delete. Yes, you want us to delete it. Or they might not. They just might delete it because that's what their job is just look for it and delete it. So definitely don't put delete if you don't need it or you want something else done with it. There may be times when you want a form deleted. Never put it in front of the study ID. If you need a specific form deleted so you can re-enter data, say you entered data into the follow-up form and it needed to go in the baseline, and you want us to delete it, let us know. We will delete that specific form. Same thing on lost to project. If you complete a lost to project and someone later says, hey, I want to stay in the program or I do want to participate in the evaluation, just let us know. We will delete the lost to project. But for those particular cases, for a form, you would email your site coordinator or me, and then we can delete just that form. Never put the word delete in front of a study ID if it's for a specific form. But if the complete record ID has been incorrectly added, let us know. So when you're in the, I'm going to try to show you this when we are in the doing the demonstration, but there are occasions occasionally you're going to enter data and then you're going to have to change a response. You're going to get this erase value of the field pop up. And this means that you've entered that the question that you answered is no longer relevant. And so you're going to need to either indicate you need to cancel the question or leave as is. And you'll get a pop-up for each question answered. So give an example. So say you answered yes, and then you get the next sequence of questions and you address those, and then you realize, wait, this client's not eligible. It should have been no. So you hit no. Well, what's going to happen is it's going to ask you, so do you want me to delete the sequential responses that you've already given? And you're going to say yes, go, go ahead. If you don't want to hide the field or you want to keep it for some reason, you would hit cancel. But you're going to get this for everything that you answered. Again, I'm going to show you this in a moment. Okay. As I mentioned, in order to do the client impact evaluation, your OTs are going to have to get the client to sign an informed consent. We're going to show you where you're going to find those. Those informed consent forms are going to be available on the REDCap file repository. For purposes of the evaluation, electronic signatures on the informed consent form are not permitted. You must get in-person signatures at one of your home mod visits. So if a person is physically unable to sign, then you can have a spouse, a caregiver, or legal power of attorney can sign. But grantee staff, your OT, OTA, home repair, no one for the grantee can sign for the person. If someone other than the client also signs, we need you to mark that on the form. The client also needs to give some sort of consent, either a verbal yes, a nonverbal, a head nod, something, and that should be noted on the signature page. So for example, if the person can't sign for whatever reason, somebody else signs, the site coordinators are going to look at all the signatures, and unless you give a note to spouse signed for client, they're going to say you need to go get this signed by the client. So you need to put a note on there to let us know why we don't have the client's signature. When you do this, we initially were saying, go back to the office, scan it. What we found is Cohort 1 grantees, a lot of them just took a picture of the page and loaded it to REDCap right then. They scanned it, they took a shot with their tablet, whatever. All we need is the last page of that package, the one with the signature, when you load it into REDCap. We don't need all 5 pages. We don't need all the other information. We just need the signature page for the informed consent. Lost a project. As I've mentioned several times, if at any time a client's been enrolled in the program, if they don't enroll in the program, you sign one. But at any time during the program, if they've been enrolled and something happens, you need to complete a lost to project form. Again, that can be done by administrative staff, but that tells us they're no longer available. That tells us stop bugging you for, hey, where's the next form? Where's, you haven't done this, you haven't done that. So you're going to tell us that this person's been lost. You're going to give us the reason why. I'll show you that in a moment. Okay, and then the last thing before I believe we will get to, we skipped over a bunch of things so I'm just going to show it to you when we do the demonstration rather than now. The one thing I do want to point out is that there is a file repository. We're going to be sending you a package with all this data, but that file repository is also where you're going to go to get a lot of the information that, or to be able to download some of the information. So it's going to have a list of the, the answer sheets that you need. It's going to have the REDCap guide. It's going to have the informed consent. Anything that you are going to need in the field is going to be available here. And so I just want you to be aware of it. I will show it to you shortly when we do the demonstration. One thing, please do not upload any files to the file repository. We didn't make that clear that that's not where you load documents. And we had a couple of grantees loading their informed consent, loading, all kinds of things there. That is not where you should load anything. And that's really important because if you load it there, it's available to everyone. It also doesn't help us then assign it. When you upload your informed consent, it is with the specific client in their record. In fact, that grantee came back to us and said, we can't find our data. And it's because they had done it in the file repository instead of with the client record. Same thing, you're going to be uploading work documentation forms. That's going to be within the client record. I'm going to show you that shortly, but we want to make sure, do not upload anything to the file repository. If I find things, I'll let you know. If for some reason someone down the line does it, I'll let you know, but it will be deleted almost immediately. I don't want to lose your data, but it can't be there because it makes it obvious, or it becomes available to everybody else. Okay, so I think we got a lot of questions during this, some that will be answered during the demonstration, but let's see what we have on board. And then we're going to take a short break. Okay, so what do we have here, Ashley?
So I had a question that I missed a few minutes ago. It
Okay.
says, if we have clients that don't fit within our program, should we then assume they aren't eligible for the older adult home modification program and fill out an evaluation? They're not sure when to fill out the form.
Okay. So you have someone who applies to the program and you say, oh, they're not eligible. You will still complete a client eligibility. You will still document the client eligibility, but you will also get to know they're not eligible for the program. And once you get there, we're going to ask you to go complete a loss to project form because they weren't eligible for your program. They applied for the older adult home modification program. This is, by the way, you have other programs, they apply to other programs. That's not relevant to here. This is only if they're applying to the HUD's older adult home modification program, or in fact, you think that they, should get this program, and then you realize they're not eligible. You finish whatever, you tell the form on the document that that client was not eligible, and then you complete a loss to project form. Hopefully that was answering the question.
Thanks, Noreen. We have a question about logging into REDCap app. So when this person logged in, it said that they required a 6-digit code to log in. They wanted to know if this will be something that will be provided to them, the 6-digit code.
No. So that's a great question. So when you logged into REDCap, you should have been, you should have had to set up your account. So and if you've already downloaded the REDCap app, that means that you did sign in and set up a password. That's a 6-digit code. So I'm going to explain how the REDCap app works. But it also we'll walk through that in a minute and come back. We'll come back to this question because I'm not sure at what point you didn't have your code or what happened, but we'll get there when we go through. But when we go through the steps for REDCap and using it in the app shortly. Okay.
So the person followed up saying that they did set it up with a password, but their password isn't the 6-digit code. And what I think they're referring to, Noreen, is when you go log into REDCap, that gives you that option to either receive a code from text message, email, like the 2-step login.
Right. So, okay, well, then we'll get back to that because there's also a 6-digit code that you have to create for the mobile app.
Okay.
So we'll see. So come back to us and ask the question again if we're not answering it when we go through the demonstration, if that's okay, Melanie. Okay.
Okay. We have another question. As an OT, a lot of the clients you see are not reliable sources of their own functionality, whether it's due to denial or cognition.
Mhm.
How do you go about that with the questions asked in the questionnaire, such as they say they don't need any help bathing, but in reality they do? Do we answer the question with their answer or based off of our clinical judgment?
So that's a really interesting question. Not sure if Tanika's on or not, but this is self-reported. So what we're going to ask you to do is, answer it based off of what they tell you. But then in the comments, because there are opportunities to put comments in there, I would say client says that they have no problems, but we noted this. So put it in the comments because these are client answers. And we don't want somebody else, like we don't want the OT answering it for them. We don't want a spouse or a caregiver answering it. You might gently say, it looks like you have a hard time stepping over. Are you sure you don't have any problem? They might change their answer, but no, this is the client. The clients are, this is self-reported. Great
And
question.
Tanika is on, and she said, great point, Noreen.
Yeah. Okay.
Uh, Going on. Can a nurse or doctor take the place of an OT or an OTA?
This is a great question because this is a program question. So my understanding is no, but Tanika, you want to say yes or no? Because my understanding is that no, you must have an OT and that the nurse or whatever, those may be supplemental, but they are not it cannot replace it.
And the answer is no, Tanika, from Tanika.
Yep. Okay.
Mm. And I think that's all we have.
Okay. Wait, let me
Questions
see.
one.
So is there a comment section to the document per report on the assessment? I guess I'm thinking of this like a Barthel or something. If it needs an OT to complete, then I think that's pretty much an endorsement to use clinical judgment. Otherwise, well, no, you don't need, no, it's not use your clinical judgment. As we said, it is that it is self-report, but you still need an OT because here's the thing. So even though these forms are standardized forms, and this is something that Tanika pointed out, I believe during our first set, the OTs are still responsible to make sure that what they're being told is true and to visually assess. So yes, we have these evaluation forms, but you don't use your your clinical judgment is set up. Okay. Okay, we'll come back to Melanie and your password and the digit. Yeah, I think you're right, Ashley. It's the 6-digit code. Yeah, completed the 2-step. Okay, okay, great. Okay, okay. Um, so James, you said understood. So there is room for comments. Yes. I believe almost every single form has a place for comments, and as well as to, just to give additional feedback. And anytime you can give that, it would be great. Okay. We are now going to take a 10-minute break. On my side, I have 11:39. So so let's plan on being back here no later than 11:39, and we will start back up at 11:50 promptly, 11:50 East Coast or Eastern Standard Time. And we will be doing a demonstration of REDCap at that point. Okay, thanks everybody. See you in 10 minutes. Okay, so we are going to get going. Excuse me. So we are now going to jump in to a demonstration of REDCap. And sorry about this. So I'm going to switch over to REDCap, and I actually purposefully let my REDCap expire so that we can do this. And just know, by the way, it's kind of a pain, but I have not yet figured out how to get back here after the demonstration. So you're going to have to let me flip through things when we come back. So we are going to move over to REDCap, and there we go. So Ashley, are you seeing REDCap?
Yes, I am.
Awesome. So what happens when you have logged in and you haven't been on for half an hour? It's going to say your REDCap session has expired, and you're just going to say log in, and you're going to be taken to the page. Now, in most cases, you're going to have to enter your password. Someone earlier asked about that said the SMS wasn't working. When you set up your account, you need to give them your cell number. That is the only way they can send you an SMS number. But so I have a password. I'm going to really be honest with everybody and say I have no idea what my password is right now, because I did write it down and then I had them save it. I also know that it's saved in my, in other places. So if I needed it, I could get back to it. So my password's already logged in. Your username, as I said, is your name underscore last name, first name, last name. So when you go to log in, you hit log in, and it's going to ask you, how do you want to get the verification? So what I'm going to do now is I'm always going to select don't prompt me for at least 24 hours. Then you have these options. So I did not give a phone number so that REDCap could call me. So I only have 3 options. They can send me an email, I can use my Google Authenticator, or I can do the SMS message. So you see here, they have my phone number. They have my cell phone number where I can accept SMS messages. So I will check for Melanie. I'm not sure if that meant that you did not give them your cell phone number and if we can add it. But I believe that you have to give, when you set up your account, you have to give them the cell phone number that you would want them to use. So when I'm going to select this SMS, it's going to pop this pop-up, and I'm going to get a little notice saying you have a text message. And when I get that notice, then it will say to complete the REDCap login, please enter the 6-digit code. Well, it's giving me a 6-digit code. I don't know whether you guys can see it on my phone. It gives a 6-digit code, but I don't actually have to enter it if I do the SMS. I just hit any letter and it automatically sends it and tells me, okay, success. And what will now happen is it will take me into the document. So some of you may be using REDCap for another project. I doubt too many of you are, but I'm going to show this to you anyway. So for me, I have 2 different projects. I know that this is my project. That's what you always want to start with. And then you're going to go to the record status dashboard. That's always going to be your starting point. So for people right now, we are going to assign you to specific DAGs. You will never be able to see other people's other states, but because I'm not assigned to a DAG, and we haven't set them, actually we have for you all, but not for me, I'm going to have different states in here. For you all, you're always going to have your state or your prime state, your particular field team ID, unless you are a subgrantee of a prime with multiple, and then you're going to have your client number. What you're going to do, as I showed you, When you go in, you can add or edit here, or you can simply say, create a new record. And I'm going to create a new record. And I'm going to say, okay, Maryland, I'm going to do CPP. That's my, I'm based in Maryland. My site ID is Maryland. My organization is Community Practitioners Valley. And I'm going to create a client number. So this is the first client. This is my first client that I'm entering into the REDCap for the evaluation. So it's going to be 001. And I'm going to hit create. And it automatically brings up the record homepage. Now, I'm going to tell you now that if you do nothing, if I do not enter anything into the client eligibility form, and I exit or I'm logged out because I've been sitting here for 30 minutes, that record's going to go. It doesn't get saved until you complete the client eligibility. And this is, as I said, this is just our documentation form. So when you go in, you have the option of just hitting today. It puts in today's date, or you can put in the date. So say, it can't be after today, but it could be, hey, you finished this form, a week ago, you're just getting around to doing it, but you want to put the date that the form was completed or that you were working on it. Form completed by, that is not your client's name, that's your name. So in this case, it's my name. In most cases, it's going to be, admin or program staff. In this case, it's not, it's me. So I'm going to identify who I am, so that if we need to have a question answered about this form, we know who to go to. Then you're going to ask several questions or answer. So as I said, this blue italic, these are your instructions. So a couple of people said, asked on different trainings, are we going to get instructions about how to complete the forms? We've embedded the instructions right into the form, so you don't have to have a separate sheet that you need to refer to. So you're going to go, anything in blue italic, bold is going to be instructions for you. Then we have, in some cases, they're also in black italic. If it says read the script, it will say read the script. In this case, most of these you're going to be able to answer directly. You don't have to ask the grantee anything. So in this case, did the potential client submit proof that they own the home they want to enroll? Yes, they did. Did they submit proof that they live in the home? So I'm going to use my tab key and move to the next question. Yes, they did, including the potential client. How many people live in the house? Well, it's a gentleman and his wife. Now, you're going to get to the potential client's annual income. Is it above the appropriate 80% AMI limit? The reason we use the word appropriate is because the AMI limit, that 80%, is going to be different. So we can't give you that number. We can just say, is it appropriate? Is it, the limit for your area? So is the household income above? No, it's not. When you hit no, it's going to ask more information because we want to tell HUD, okay, these grantees in cohort 2, they're actually serving a lot of clients who are between 50 and 80%, or in this case, we're going to say no again, between 30 and 50. So we're trying to identify how, what's the income level that you guys are actually serving? Or you may not have the available. If it says no, see what just happened is that I said yes, nothing happened. I said information not available, nothing happened. I said no, it gave me a drop down. So that's the skip logic that we're talking about, how it moves you through. And this is the type of thing that you can use it online like this. The same is going to happen when you are working in the field. It will skip through. So does the physical condition of the client's home meet the grantee's eligibility requirement? So some of you may have your own requirements. You can say, yes, it does, or no, it doesn't. This doesn't actually tell us anything, or it's just what it tells us that there may be other issues that we will look for in the rest of your responses. And then this part about the potential client most comfortable. So internally, we have English and Spanish speaking site coordinators. So this actually will help us because when we go to do our client process surveys, while you will be able to do, provide services to whomever, if they don't speak English or Spanish or one of the languages that one of our site coordinators speaks, because we have it, one of our site coordinators speaks several languages. If it's another language, you're going to tell us what, and we might be able to include them in the client process surveys. Otherwise, it's probably only going to be the English and Spanish. And again, that doesn't impact you in any way because we still want you to move forward. If you have, if you're dealing with a Spanish speaking client, then you have people on staff that can do this or other languages. These folks are still part of your program. We still want you to complete the forms. Okay.
Excuse me, Noreen.
Yes.
We have
Yeah.
a question. What if they have a translator by family?
That's okay, as long as the translator is asking the question. Wait, a family translator. Initially, we said no. As long as the translator is asking the questions and translating the questions, I think it's okay. But again, they cannot be answering the questions for the client. And we probably would not be. I mean, if you're using, I don't know how the program works with that, and how the program deals with a family member. We generally didn't like that because we were concerned that the family member would automatically answer the questions for them. So I know that's kind of a vague answer. But if it comes up, please let us know and we'll try to be a little bit more specific. Okay, potential age and years, say they're 64. So that meant they were born in, so in 1960. So is the potential client ineligible due to organization specific criteria not mentioned above? We can say yes. It's going to ask you why. You can say no or not applicable. It's not going to ask you anything. Is the potential client eligible for the program? If you say no, it's going to ask you to go straight to the Lost to Project form and complete it. And I'll show you that in a moment. If you say yes, they're eligible, and you click on yes, you're going to get your next set of questions and instructions. So it's going to tell you, here's what we want you to do. Here's how we want you to do it. It looks like a lot right now. What I'm going to say is that when you're doing this, once you get accustomed to it, you're going to know, you're going to learn the instructions pretty easily. One thing here, very often people will apply for the program. And then when the OT gets to do the site visit, they realize, both the husband and wife or both people who live in the house are eligible for the program. They both own the house. They're both over 62. They both, are the homeowner and they reside there. But the client is not the person who called. It's not the person that they just answered all these questions for. It's maybe their mother. It's maybe their spouse who is different. So what we want you to do is go up and answer the questions for 5 and 6 for the person that you all determine is the client. And we want you to then put all that information in here. So instead of Joe Schmo, it's now Mary Schmo, or Mary Smith. So we're going to put in the client's name. So this is when the client's name is put in. It's the only form where the client's name is entered. And so we're going to put in their address. This information, we will use it for, things that we're going to use it for some things in our reporting, but mostly it's going to be used for the site coordinators when they're making their calls. And this is going to be because it will tell them a timeline, or the time zone. It will give them the other information. We may also end up using some of this, if we can, to get a little bit deeper into census tracts or areas or counties, so we have a better sense of what's going on in specific areas. So again, if the client doesn't have a phone, you would answer no, they don't have a phone. If they need to use TTY or TDD, which are the hearing, please let us know and we can accommodate that, but we need to know that ahead of the time. So some of your clients are probably still working. We need to know, is there a number to reach during the day? Is it the preferred contact method? Do they want texts or calls? This is how our site coordinators are going to be reaching out to your clients to do that client process surveys. So this information is very essential to us. We also will use, when available, the email address. And we found that that was very helpful in some cases, because sometimes people aren't going to answer a call if they don't know the number. But if you email them and say, hi, we're from Solutions, we're doing this project with, and they'll use your grantee name, and we're assessing how they did with your the program, we'd like to talk to you, they'll then respond. Okay, so then we also are collecting a lot of demographic information. So what's the gender? You know, are you Hispanic or Spanish origin? What's your race? This is all information that HUD has asked us to see who's the project serving. So I'm going to actually go and see, I'm going to put in some numbers and just make up some stuff here. And is this a preferred? No. I'm going to put in the same thing, so it doesn't really matter, but that's okay. Okay. Now, then we're going to say, I'm going to enter this just so you know what is going to happen. Okay. In here, again, the blue, you are going to have some instructions that say, hand the client this answer card, hand the client that answer card. All of the answer cards are going to be in the file repository. We want you to download them, preferably print like answer cards or things that you are going to use on a constant basis with your clients. We would recommend that you download them, potentially laminate the form so it can be used over and over again. But you will need to download these cards beforehand so that you can hand them to the client when you are going through the questionnaires. So all of these are very important for us to be able to get HUD the information that they need. When you get down here, you're going to say, we said that there were 2 people. And so who lives in the same house with you? What's going to happen is if you say children, it's going to say, are there any that are over 62? Because this tells us, even though the person that's identified as a client is the client, there are other people who are older adults who are probably benefiting from the program. And so we want to know how many other people are available. So we have then contact notes. So we say, you know, hearing issues or anything, you could use this for any kind of notes that you want to identify on the form. Okay, now, this is very important. 2 things. During any time while you're working the form, you can save and exit the form. We actually recommend that you save and stay in the form often so you don't get knocked out. So if you have this little drop down, save and go to the next form, you hit that down arrow, you have different options. Stay and save and stay, save and go to the next record, that's the next client, or exit the record, or save and go to the next record. So you have these options. We recommend that you save and stay very often. When you do that, you will get a list of what questions have you not answered. The one thing is that if you need to notice which ones you haven't answered, because it doesn't automatically take you to those questions. So if I say okay, then I know that I need to go back to 3A or something. I didn't answer some, here, I didn't answer that one. So I'm going to say, yes, it is. And then I'm going to go down. Now, the other thing to know, when you finish your form, you've entered all the data that you can, then I want you, then you need to go back and say, that the form was completed. And the reason is that it will show up. I'm going to save and exit and show you why. So save and exit the form. There are probably some other questions that there's one. In this particular case, I'm going to ignore and leave the record. I'm not going to go to the next form, just going to ignore and leave the record. Because I didn't hit complete, the client eligibility form still shows up as red. That means it's not completed. When we're looking at these and we're doing our quality control checks, we're going to say, why is that client eligibility form still red? Why is it not completed? In order for it to show up as complete, you need to tell us that it's complete by going all the way to the bottom and saying it's complete. In some cases, you're going to complete it even though you know you didn't answer some of those questions. So we really want you to answer as many questions as possible, or not answered or whatever. Excuse me, but there are going to be some times that you're not going to be able to, and we know that. So last time I did ignore and leave record. This time I'm going to say ignore and go to the next form. And what it's going to do is automatically open the next form in our sequence. And this is great because the client program questionnaire is one of one of the 3 forms that you're going to do 2 times. You're going to do it at baseline and you're going to do it at follow-up. And it will tell you some information. At baseline, this form should only be completed by an OT. It also is going to tell you, because this is the baseline form, make sure that this is your baseline visit. And that may seem, okay, well, we already got that. Well, sometimes people get a little confused. So again, you're going to put in the date. You're going to say who is completing the form. This is really important. We're going to tell HUD, the grantees, 80% of their forms were completed by OT, OTA, CAPS. 20% were completed by other. And they're going to ask us, well, who else was completing this form if we said no one but them could do it? So we need to know, give them a sense of who's doing it, if the OT, the allowed people or not. So again, the blue is going to give you the instructions. Again, here's particular answer card goes with this form. So you got to have those answer cards to be able to hand them. Now, I will say that some of the grantees from cohort 1 said that they would take the answer card, they would hand the answer card to the client, and yet they still offered the answer to the client just in case the client had difficulty either reading it or answering it. So they walked the client through. That's up to you, however you want to do it. Again, here's that read verbatim. We need you to read this completely verbatim so that when we compare it to other data sets, we're saying it exactly the way they do. So do you have any difficulty bathing or showering? No, and I don't need help. Yes, but I don't need help. Need help regardless of difficulty. It's not answered. So I'm just going to skip through some of these very quickly. I'm using my tab to move through so that I don't skip any of them. Sorry, and I'm also a little slow on some of these. So when you get to the bottom, if any of the questions were not answered, we want you to go back and try to get, because again, not answered is not going to help us when we're trying to evaluate changes that the client had because of the home modification. So we're going to ask you to go back up and see if you can get them to say, I don't have any difficult. No, I don't really, or yes, but I can deal with it. And if you go up here, this is one of those things you don't have to hit reset because you can only select one answer. So once you select it, it will just automatically go back to, it will just move to the answer you select. You're going to walk through it. I'm not going to actually answer all these questions. This is the type of thing that when we open this up to you and you have access to REDCap, we want you to go through this and learn how these work. I'm going to point out this answer card because people are going to be confused by it. The way the falls efficacy scale works is opposite to what you want or what your intuitive thinking might be. So I believe that 10 is, I can never remember which is good and which is bad, but it's not what you would normally think. But you're going to put it in. So the number between 1 and 10 that they point to on the answer card, you know, or 0 if they're not answering the question. So again, you're going to go through all this. Back to that skip logic. So in the past 12 months, how many times have you fallen? If you say 0, okay, you're done. You're going to hit complete the form. And you're going to save and exit. But if you hit 4, what's going to happen is it's going to ask more questions. So you're going to say, okay, how many of those falls occurred while you were in your home or your property? If you say 0, okay, you're done. If you say 2, you're going to have another drop down. So then we want to know, where did they occur? And then not only where they occurred, we want to know the dates of when they occurred. Approximate is good, just the month and the year or whatever in the past year. And then we want to know why, because some of these are also going to help you all as you're figuring out the type of modifications that might be needed, but it's going to help us understand, okay, what are some of the issues that your clients are having? So we're going to get all the way through. Again, it's going to do that pop-up at me because I have not answered the questions. In this particular case, I'm going to ignore it and go to, leave the record. So you're going to go through each of these answering the questions. We have these set up so that initially we had it in a different sequence. I'm going to tell you that. You can do these 3 however works best for you. Okay, that shouldn't be showing, but that's okay. You won't actually ever see the client process survey. I need to make sure that that's not showing up, but some things are showing up here that you will not ever see because of the way my my setup is. Okay, client impact interview. The client impact interview, I'm going to go through really quickly because I want to show you how you are going to be loading it. You're going to go through, you're going to say, you're only going to conduct this interview with the client enrolled in the program, as well as, and it has to be done by the OT, OTA, or CAPS. So you're going to make sure that, this information is accurate for the other forms. And then for each answer, don't give not answered as an option, gently probe. Then you're going to get down here. You're going to give them this information. We are doing, we're evaluating the client, the HUD older adult home modification program. And then you're going to give that informed consent package to the client. But then we are going to ask you to read through that with the client right then and there. And then tell them, I need you to sign this. So if they don't sign it, what happens is you're going to say no. You're going to tell us, why they didn't want to sign it or what the issue was. You're going to hit complete and you're going to be done. I'm just going to put something there to see if I get what I think I'm going to get. Now, however, the client says, sure, I'm going to sign that, and they hit yes. Okay, it doesn't. So what's going to happen is you are now going to have them answer a lot more questions about their health, about, how many times they've been to the hospital, that kind of thing. You can, if you take a picture right then and there of the client, the signed consent form, you're going to save it to your computer. You're going to title it a specific way. You're going to title it ICF, Informed Consent Form, _. You're going to use that study ID for the client. which is up here. It's MD-CPV-001 underscore and the date they signed it. And you're going to go ahead and upload that file. So you can do it, when you get back to your office or a secure place, if you're using the mobile app, or you can do it whenever, but you do have to load that file in here so that we know that the client has agreed. And the reason that we want you to do that is because this document is going to have a lot more questions that you are probably not asking for your program anyway, but they are going to help us determine some things as how good is their health? What are the issues that you're dealing with? And this is the type of information that, again, we need to share with HUD so they understand how the program's working. It's also going to allow our economists to look at this and say, okay, this is the typical, client that the older adult home modification grantees are getting. This is how many times they're in the hospital. So, for example, if you get down here, how many times have you had them? Have you had any? You're going to say yes. It's going to say how many. 2. It's going to ask information for each visit. Did you go to the hospital? Did you go to the emergency care? Did you have to stay overnight? Did you have to do all these? Because what we're looking for is when we come back and do this again, 6 to 9 months later, we want to know what's changed. Did your modifications help reduce your clients going to the hospital, going to urgent care, having to stay in the hospital? You'll see another one. Here is the EQ5D3L. That is a form. It's basically the questions here are tied specifically to that data set. And so we need you to use that answer sheet when you do this set. Again, this is why we want you to take the next 2 weeks or almost 2 weeks to go through, understand REDCap, get accustomed to it, understand what you're going to be asking. So, for example, here's another skip logic. During the past 4 weeks, have you been here? Have you done this? So if you say no, nothing else happens. If you say yes, then you're going to answer these questions. I've gone 1 to 3 times. I needed personal assistance to get there. Some are going to be no, some are going to be yes. So basically, these are the types of questions that you're going to go through to answer. So here's another example. I want to get to one that shows you where most of these are, you only have the option of answering one question. I'm looking for one where you can have multiple choice. I don't think I have any in here. Okay, we're going to say, oh, this is important. So I've just answered a bunch of things. If I don't hit save or save and stay or exit, if I hit cancel, it's going to say you're going to lose all the things that you've done on this form. So I'm like, yeah, that's fine. Or I'm going to cancel it. It's going to take me back to the form. We're going to save and exit the form for the moment. I'm trying to make sure that I'm telling you. So we had put these, just so you all are aware, we had put most of these on slide deck. And then we realized it's probably easier for us to show it to you in this form. Okay, so as I said, you're not going to see all of these. When you finish all of these baseline for you, the next thing you're going to do, it's kind of an odd sequence because then you're going to follow up, but your next follow-up is going to be work documentation. I'll show you the home checklist just so we can get it through. It's going to be done the same way. Whoever is doing the completing the form, it's not the client. You're going to walk through. For this form, there are some things that you're going to be able to do. If you don't know the answer, then you ask the client. But a lot of times you're going to be able to answer these questions yourself, and you're going to walk through. This is going to have a fair number of skips. It's going to ask you, okay, excuse me, I'm going to look at this real quick. So there are 2 stories in this house. So now it's going to bring up a whole bunch of other questions. Oops. So I hit enter. This will happen every time because it's going to not save certain things. Okay, we're going to ignore. Okay. So one other thing, while you are testing, you're not testing this, but while you're practicing, if you get a pop-up that I haven't talked about or that you don't understand, please let me know, because it could be that something in the programming wasn't done right. But if I don't hear about it, we can't fix it. So, we've had multiple people test this, but please, please, please look at it and let us know. So, yes, it's a hazard, and yes, it's not a hazard. Yes, but it's not a hazard. And you're going to go through all these questions, and most of this you're looking at. This is not something that the client is actually answering. If you have a multi-unit building, like an apartment or condo or a co-op, only answer some of these questions for the unit itself, not the entire, any common areas. No, and okay. Trying to find one. You're going to have this little reset. So I haven't found one, but there are some places where you can give multiple answers. If you do give multiple answers and some of them you say, oh, wait, that was wrong, you're going to hit the reset. It's going to clear all of them. You're going to ask the questions again. Okay, I'm just going to save and exit the form. I'm going to be told that I have missed a lot of questions. I'm going to say ignore and leave the record. In some cases, you're going to hit ignore and leave the record because you need to come back. So that definitely is why you want to wait until you've actually finished the form before you hit complete. Okay, so you've done your hazard checklist. You finally are doing your home modifications. Now you're going to go to your work documentation. The work documentation, the same thing starts. When did you start the work? When you started the work is not the day you decided what work you were going to do. It is the day that your contractor, your home repair people, whomever, got into the house to start the work. Then, what's the date that they finished it? Sorry, I hit the wrong thing again. And you will do it too. So that's why we say save and stay all the time. I have a tendency to hit enter, which wants to push you out. Okay, so we finished the work today. Did you do any additional home mods after the initial mods were done? No, we didn't. Did you have to get HUD pre-approval? So some of you will be getting pre-approval for your work because it's over the cap or something else. Yeah, I got it. It was great. That's fine. Did it require an environmental review? No. These questions are important because, again, it tells us how many things had to happen before you could do your work. So you finish all this, and then you're going to go up and you're going to download straight from the form itself the work documentation template. And it's going to open up an Excel spreadsheet. And I'm going to flip over to the spreadsheet. I don't think it's going to automatically do this, but I don't think it's going to open the file for me automatically. So I think I have to reshare. Ashley, did it move, or do I need to open?
Sorry, I was muted.
Are you seeing the Excel spreadsheet? Probably not, right?
I'm not seeing the Excel spreadsheet.
Okay, great. Not great, but thanks. So let me get to the Excel spreadsheet and then we'll come right back. Okay. And of course, it's not showing me a spreadsheet. Sorry, hang on half a second. I may have moved too quickly. Okay, we're going to come back to this in a moment. because it's not showing me the spreadsheet yet. I haven't had this issue yet, so that's kind of a pain. Okay, so we're back to this. What's going to happen is I'll go out and show it to you in a moment. You're going to download the work documentation, and then you're going to go to that form. You're going to complete it. I'm going to show you what it looks like in a moment. You're also going to rename it and save it to your computer. When you rename it, we want you to say home mods underscore, again, the study ID, and then underscore the date. And then when you finish filling out the form, you're going to come back here and you're going to upload it. And you're going to hit the upload. It's going to ask you to find the file on your computer, choose it, upload the file. In addition to the work documentation in the spreadsheet, we are going to ask that if you take pictures, and we encourage you to do so, excuse me, before and after pictures, please put them in here as well. Any pictures, any kind of invoices, any kind of information that you can share to help us get a better sense of what your project for this particular client entailed. And notice, as I said earlier, you're loading it here, so it's going to be tied to this client. Even though we're asking you, put the client information on the form as well, it's because when we download everything, we want to make sure it easily matches. Otherwise, we have to go through and try to identify it sometimes ourselves. But this way, we have everything in one package, and you also have that packaged here. So say you do the work documentation template, you've completed your form and you need to make some changes to it. What we want you to do is make those changes and then come back and reload it here. We don't want a separate form. We want the final form that you used for that client. Okay, now I think we have gotten most, I know the next thing. So we're going to cancel, we're going to save and exit the form. I like. And I'm going to ignore because I have not. So it says, you haven't loaded it yet, and it's going to tell us that. You're going to ignore it and come back to do that. So at some point, it's just going to happen. You're not going to, some clients or some applicants are not going to be eligible. You're going to go to the lost to project form. In this case, so this person you had deemed eligible. So for whatever reason, some people are going to be not eligible. That's when you're going to say has not been enrolled and is not eligible. That's going to give us the idea of like why this person wasn't enrolled. In this case, this person was enrolled. But now, so if you say has been enrolled, it's going to tell us, well, when were they and why were they not eligible? And you're going to go down the form, this is going to tell us why. They were less than 62 years old. They didn't own their home. Another reason that was not, that they could not be enrolled in the program. When you hit other reason, we're not going to get that information. So anything here is better. Actually, I'm going to see if we can give other reason to see if our folks can add a comment, because I think that if there's another reason, it would be great. Here's another thing. This option is here as well. The home structure was not a good fit. In some cases, you may find that you can't do work in a home and the home structure wasn't a good fit. If you end up selecting that, then definitely please tell us why, or what the issue was. Now, that's for someone who was not enrolled. In this case, they were enrolled. So remember I said that sometimes if you answer a question that you shouldn't have answered, it's going to ask, hey, you already answered this question. This is one of those cases. And what's going to happen is say, I want to erase the value. That was wrong. I'm just going to hit OK. If I had answered multiple questions, I'd have to answer that for every one. In this case, the person needs to be de-enrolled. Again, I'm going to put the date that we completed it, which in some case, most times is today, but we realized it, a couple of days ago. So I'm going to put that date in so that we have that information. You're going to, oh, okay, I did it wrong. It fixed it for me. That's okay. Sorry. I guess it didn't fix it for me. And then I'm going to, go through all of this again, have my organization, and then you're going to go down and say why. And in some cases, this is because the person declined to sign the informed consent, or they signed it and they still didn't want to do it. But again, they're still in the program. They just don't want to participate in the evaluation. So this is also, if you do this, we want you to sign this if they don't want to do the 6 to 9 month follow-up, but they do everything else and they're still in the program. Okay, and you're going to hit always. Once you're done, hit complete, save and exit form. It's going to tell me I didn't answer some questions, and we're still going to ignore and leave the record. And now I'm going to see very quickly whether that home, actually, yeah, no, I'm going to have to show that very quickly. So we only gave these, probably should have given a little bit more time for this than we have, but I'm going to try to show you here we go. Okay, so this is the work documentation form. There are 2 tabs that you're going to work in. The first tab is the cost tab, and I just opened one that I'd already done. So you're going to put in your site ID, your field team ID, your client. You're going to put the date that you completed it and the name. Now, you're also going to have the option to say, okay, I spent $21.50 using the HUD money from this program. But I also did some other work, and we have a couple of drop downs. So I used another program. So I had a program, you have an internal program that you have some money that you could do. You spent $800 there. Oh, I was able to use some weatherization money. You select the weatherization, you tell how much. So this tells us that you actually spent $52.50 in this person's home. But it also tells that only $21.50 was from the older adult home modification program. Then you're going to go to tasks. You're going to go in and you're going to number your tasks. So I will tell you that because this form is protected and you only have a limited number, when you move around, it's not going to let you move around that easily, but you want to come here, you're going to number your tasks. Once you've entered data, it changes it to white. Anything in this goldenrod color, you must enter the data there. We have drop down. So the drop down here are things that are the categories that have been listed by HUD. So if you go in and you say, okay, I'm going to put grab bars. Well, where did you put those grab bars? You're going to go to the next item. In some cases, you cannot answer anything over here until you've answered everything on the left-hand side. And that's how it moves you through. If you try to answer it without, it won't let you. It won't tell anything. So where you put in grab bars, you installed them. So so this description, by the way, this is something that will give us more information. And we found it extraordinarily important. And so we've now made it a requirement. So in the grab bars, you can say whatever you need to do, entrance to door, entrance to house or whatever. So in fact, it's kind of interesting because you could, in this case, say that was an exterior. I'm going to go over a little bit more so I can show it. Or you can say it's interior. You're going to tell us where did that happen. It was in the foyer. But knowing where this description helps us understand where it came from. So this, again, this was something that was paid for through the sorry, the older home adult program. But you'll see there was some work done also. You put some weather stripping in, and it was used with the DOE program. The reason that we want to know this is so that we're not attributing all of the benefits of things that you did to the older adult home modification program, to the HUD program. We're trying to be clear to say, you know, the client said this, but we noticed all these other things were done before or after as part of this. And I say before and after because my understanding is that you're not supposed to be doing some of this work until you, if you can't use other funding at the same time. We want you to do anything you did before and after in order to do the home modification program for the evaluation. It's not something that you're collecting or you're giving to lead hazard control, but we need as much information as possible so we can understand how this program worked. So again, when you're done, you are going to save a copy of it onto your computer and you are going to name it home mod _. You're going to name it the use your study ID, and then you're going to give it the date. And then you're going to save it. And then when you go back into, oh, of course I did it wrong because you can't. We want you to give the date, but generally you're going to do it, you know, 3 dot, you're going to do the date like this. Sorry. Okay. So that is, I'm going to give a couple of minutes to ask some questions before I move into the rest of this. And I know that I have to come back, sorry. So that is kind of our demonstration. I think that I covered everything. Oh, the one thing that I do want to show before I take us out of here. And I am sorry, I've been moving around, so hopefully you may have knocked us out of that. So hang on half a second. I'm going to go back to REDCap because I want to show you the file repository, because that's very important. This is where you're going to be able to collect a lot of the data, or not collect data, but get the forms that you're going to need. And I am not, that's not where I want to be. Okay. Over here, you're going to have this, the file repository. You're going to click on the file repository. The file repository is going to have documents that you will need. It's going to have the informed consent. It's going to have your answer card. It's going to, I'm actually going to change this so the cover sheet is on the informed consent. So you're getting one package and not having to download different things. But all you have to do is click and it automatically downloads. Once you, this is why I wasn't sure if the Excel spreadsheet was going to show. It then will give you the form or whatever document. So these answer cards are the ones where I think that you should print them out on like a card copy, and then also laminate them, because you're going to take them to the client's house every time. You're going to hand the card to them for different forms. Same thing. You're going to go to the informed consent and you're going to click on it. It's going to automatically download. You're going to open it. The informed consent, we want you to take a copy of this to leave with the client. There are 5 pages. All we need you to load is this last page, the statement of consent. Once the client signs, dates it, print the name. If someone other than the client signs it, please indicate why. Write on the sheet, you know, whatever you need to do, take a picture of it, scan it before you load it, so we have that information.
Excuse me, Noreen.
Yes.
I have a question.
Okay.
I think the question is, can you tell us again where to save the uploaded signed consent?
Yes. Okay, great question. So what happens is that after you get the informed consent, you're going to go to your record dashboard. You're going to find the specific client that you're working with. You're going to have to look here. So here, it's Mary Smith. I still need to do the client impact interview. Now, in this particular case, I'm also going to mention I chose continue. You should not continue. until you have actually signed, uploaded. Normally, you should leave it as incomplete until you have uploaded it. So once they have that signed, that sheet, you're going to come back to the client, the specific client, and you're going to say upload. You're going to find the file on your computer and you're going to upload that signed consent sheet. Okay. I'm sorry, I know that we are running a little, going a little slow. I'm going to try to answer any questions that we have right now on the demonstration, and then I'm going to go into the mobile. But let's see if there are any other questions that we should be addressing right now. And while I'm moving back to the slideshow, Ashley, you want to
Yes.
ask them? Yeah.
So what is the average amount of time does the entire evaluation take?
It's a great question, and it really depends on several things. When we timed it, we have been told, well, we timed it and we had to come up with an amount of time that it took for our Office of Management and Budget Review. We thought it took about an hour, maybe 45 minutes. Some of the grantees have told us that it took them much longer. I think part of it is that as you get accustomed to doing it, it is faster. It also depends upon your client. If your client wants to chat or if it's taking longer, it can take longer. It can take up to, 90 minutes.
Thank you. Where are the OT recommendations for home mods going initially?
Okay, so that's something that's a program. So you're going to be, I'm not quite sure how your programs do that, but we're not necessarily getting it. You're going to complete the home hazard checklist for us, but we may not see, we will in fact most likely not see what the recommendations are. I don't think there are any forms that have that for us because that's something that each program does internally.
Thank you. I was skimming the question. Tanika, thank you for jumping in and answering some of these questions for us. Skimming, sorry. I think Tanika jumped in and answered most
A
of the
couple,
questions.
and that's great. That's fine because I'm seeing that some of the grantee, the primes or the managers are also doing the same thing, especially if there is an OT.
Yeah. So I think that's what we have for right now for us.
Okay, great. I'm going to get now into this we already covered. So does that, okay, so we will answer this. So does the OT fill out the work that's been done or other people in the organization? So because it's not necessarily the OT who is, you're not doing the work, it's generally going to be done by admin staff or program staff in the organization, not the OT completing the work documentation form. So this form that's up here, we'd set this up differently, but I've already shown it to you on REDCap. The OT is not normally going to do this form. Sorry. We set these up and then I forgot to take them down. And now I'm just going to skip through. Okay, the mobile app. This is, as we said, it's a complementary tool for the online. It's available via tablet or phone. And you're going to use it mostly when you're working where there isn't any Wi-Fi or you have spotty Wi-Fi. Now, the thing to remember, this must be used in combination with the online REDCap. So you're going to have to download your client records before you go out in the field. That's something that a lot of people they don't remember. Okay, when you set up your mobile device, what's going to happen is you're going to download the app and you're going to set up your own login. So you're going to go to the App Store, whatever it is on your, personal, and you are going to download REDCap onto your mobile device. When you download it, it's going to ask you to enter a 6-digit admin pin. So this may or may not be what Melanie was running into. So when you set it up on your device, it should ask you that. If for some reason you set it up on your mobile device and it never showed you that, it means that it was not set up properly. What I would recommend you do is you delete it from the mobile device and start it again. And I'm going to say two things about this, however. So you're going to open it, you're going to enter your 6-digit admin pin that you establish. It's your choice. If you are working in an environment, if you are a grantee has, say, several tablets that will be used by your organization by different people, I would recommend that that organization have an admin pin that they use, because you want that. You always want to be able to access it again later, because if data is not synced with the server, you could lose it. And we had that happen with some of the cohort 1 folks. So, but if you have an admin number or an admin pin for your organization, the admin can always go in and get the data. So then under create data collector, that's where you put the individual OT or home assessor or whomever who's going to collect that data. And that's where you're going to enter the same username you use for your online, your first name and your last name, and then you're going to set up your personal 6-digit number. Again, if you lose this number or your username, you have to let us know. We can't reset it. We have to go to Vanderbilt to get it. So what's going to happen is when you're online, you are going to log in as as usual. Then you're going to click on this little thing down here. It says REDCap mobile app, and it's going to take you to a setup project tab on the REDCap mobile app page. And what happens is, I'm sorry, I think I'm skipping ahead for some reason. It's doing this weird thing. So what happens is that when you select REDCap mobile app, it's going to then pop up another thing, and it's going to say generate API token. And when you do that, it's then going to give you a pop-up. The pop-up will show, okay, which is a QR code. You're going to take your tablet, you're going to take a picture of that QR code, and that's going to open the app on your device. The next thing that's going to happen is you're going to then go to the device and you're going to say, set up, I want you to set up the mobile project. It's going to initialize it. It's going to open up, the QR scan. It's going to open it on this is what it's going to look like on your tablet. Okay. Then oh, criminy, sorry, something just went wrong. And I got knocked out. Hang on. Gotta be coming back. Don't know what happened. Means I'm going to have to skip through again. And I apologize. Get me out of the presentation. And I apologize that we did not get through as much as I thought. I will continue this, so if people want to stay on, if you can, that's fine. I'm also going to be in Minnesota at the training, so if folks want to practice with this and or reach out to me in the meantime, I will be doing mostly Q&A in Minnesota, and not a true session like this. But I will be available for kind of one-on-one to help you with any kind of issues that you might have, and to help people set up their laptops. Okay, so it's going to generate the AP. You're going to get the QR code. Then what's going to happen is that once it's downloaded onto the mobile app, you're going to say, approve that results, and then you're going to go to set up project. So these are the pictures. I'm going to send the REDCap guide. All of these steps are also in the guide. So don't worry if we don't get through them. You can get to them at that point. Now, before you go in the field, this is very important. While you have access to internet, you have to go in. We want you to go online, make sure the client records are there, and then we want you to go in and download the records onto the mobile app. You can download all of them, or you can download just some of them. But what you're going to do is you're going to log on to the mobile app. You're going to click on the Cohort 2 program to open the page with the choices, and then you are going to choose Download Server Records. And then, for some reason, I can't tell you why, you're going to have to just skip through the next pop-ups until you get to the choose download. It's going to say download X records. And the X is actually however many records you have on your server. You can download all of them, or you can say, no, I only want a smaller set. A lot of times people only do download the records they need for that day or that week. And so you get a partial set. And if you select that, then it's going to go down and it's going to say, which ones do you want? And you're going to click on the records that you want. And then you're going to download those particular records. So then what happens is you're going to get you're going to get the number that you've downloaded. And then when you're ready to collect the data, you're going to go to collect data. And then you're going to select the record for whomever you want to collect the data for. And then you have the option to select baseline. And then you have option to select form. This goes back to make sure you are doing baseline when you're at the baseline or follow-up when you're at the follow-up. When you're done and you're back to a secure location, you need to then sync the data because the data is saved on your mobile device. It is not saved on the server. So when you go back and you are now have access to the server or online internet, then you are going to say, send the data to the server. What's going to happen is you're going to get a notice saying begin to send. All it's going to do is any new data or any modified data will be loaded. It will not override anything you've already done. Make sure that you do it when you have good internet service and a secure location. Then when you get to, okay, is it done? Make sure it says sync complete. Make sure that you go and you look at the server and yeah, you see it did get over there. Do that before you delete any records off the mobile app. Otherwise, you lose everything. Because the mobile app, if you delete it off the mobile app, it is not saved anywhere else. So this is going to be, this is a really important tool. Okay. Now, during the next couple of weeks while you're practicing, we would recommend you have the mobile app, you're working it, most of you are going to be in a place with online access. But if you want to use it in the field, just turn the mobile app to airplane mode, and it will basically simulate you working in an environment where there isn't any access. So I know I went through that like very, very fast. We're coming up on time. I am happy to stay on for as long as we need to answer questions. So what questions do we have? I know we have a lot, and I'm so sorry I didn't get through this faster.
We have two questions, Noreen.
Okay.
So after you download your records, are the actual forms offline so you don't have to be connected to the Wi-Fi or cell phone to fill it out? So I'm guessing.
Okay, so what I think you're asking, Alan, is after you download the records, the forms they're on the mobile app. So they're on your iPad or your tablet. So you're filling it out on that mobile app. So you do not need to be connected to Wi-Fi or have cell service to fill out the form. Yes, that's why you have to download it beforehand so that you have the client number, the study ID, you have the client information, you're downloading that. And then when you go in to the form and you select that form, it will automatically open up the forms just like it would on the online server.
Next question. Will we have access to a recording of this meeting?
Yes. We will be sending out, like anybody who has signed up for the registration and anybody who is going to have REDCap, I will send this information out to everyone, probably not until tomorrow, because we're making some changes to the REDCap guide. But all of it will come out at the very worst over the weekend. But then you will have until April 11th, close of business to get into REDCap, to work with it. If you were if you are not going to Minnesota and you have questions, make sure you share them with whomever from your organization is going, and or if you're a subrecipient, make sure you share it with your prime grantee so they ask questions and we will incorporate them into the frequently asked question, and I will try to explain everything to them so that they can bring it back. If we need to have a follow-up session, let me know, and we will figure out how to set up another session, maybe in the next couple of weeks after you've had a chance to play with it. If you are working in the REDCap at any point after we go live, please always say fake or make up something fake so we know it's not real. But we would prefer that you try to do as much of your practicing with REDCap over the next 2 weeks once you get REDCap access. Again, if you don't have REDCap permissions yet, please, or you have other folks on your staff, now that you've seen this, know that they will need it. Please send me their name, their title, the role that they have within the program, their email and phone number, preferably by the end of today or no later than over the weekend. And I will be continuing to upload. We have sent one batch, but we will need to do more, I'm sure. Okay, any other questions?
That is all.
Thank you all so much for being patient with me as I went through some of this stuff and couldn't go through some of it. And we really appreciate your time. We know you're going to have more questions. We are very excited to get started with this with you, and we look forward to working with you. So have a good rest of your day and a good weekend. Yes. Wait. So if you put something in on the chat to Ashley, then you can put it there, and we'll be collecting it. So JL, Ashley, should I also send my information? I think that we're
I have it.
covered. Okay,
Thank you, James.
perfect. Okay, perfect. Thank you all, thank you everyone. Have a great rest of the day and a good weekend.